Okay, I only have 15 minutes per session here, so picking up where we left off. Prevention applying to HIV, the primary, secondary, tertiary is after a person is HIV positive, what they will do is they will monitor viral load, which is basically how much of the HIV virus is in your blood. And this just, obviously is a determines how the patient's doing in terms of the disease and the treatment. And it basically is a better predictor of disease progression and the amount of time that remains until they get full-blown AIDS. Okay, so the treatment is called ART, antiviral treatment. These are some of the medications, the different kinds of medications, and you can see they there are some that are similar to the chemotherapy drugs that have been highlighted in the oncology chapter. So the CD4 count is the best indicator of immune function and whether or not to start ART. So some of the specifics of this treatment is that it's generally they start it earlier now, and as I said before, oftentimes people with HIV, it's really like living with a chronic disease rather than a life sentence or a death sentence, and there are specific goals with respect to this treatment related to decreasing the impact of HIV/AIDS and increasing the effectiveness of the immune function. It will target different stages of the HIV virus life cycle, and it's really very effective in the majority of the cases. One of the issues with this therapy is that there's a lot of side effects, and so compliance can be very much an issue with this. There's a lot of medications. It's pretty intensive. You have to follow the regimen very closely. So things like lack of support, substance abuse, poor relationships with the healthcare provider, depression, lots of things can contribute to noncompliance. So here, as you can see, the side effects are in the same way that chemotherapy is, are very pervasive. There's a lot of things that can be affected by these drugs. And we will talk a little bit about immune reconstitution inflammatory syndrome, IRIS. And this is an issue where there is, the treatment initiates this rapid restoration of immune response, and there's a paradoxical worsening of the existing disease or appearance of new disease, and it's characterized by low T cell count, CD4, and high viral load, in other words, HIV. And you can see here listed on the left-hand side common manifestations of IRIS. Here are some of the opportunistic infections that sometimes occur with HIV/AIDS, and I've listed over here some of the more common ones. I want you to be familiar with Kaposi sarcoma, and really HIV/AIDS can affect just about any organ. So some of the important nursing implications for dealing with HIV/AIDS is, of course, standard precautions because of all of the issues with the medications and immunosuppression. You need to be familiar with the treatment options and how to take care of the patient who's having side effects of the treatments. Education is huge, compliance is huge, and knowing resources. Medications can be, I don't know what the cost of them are, but I've heard they're very expensive, so they are going to need resources to help them with that. And also, this can be can be a problem with people's attitudes about people who are infected with HIV/AIDS. So it's really important that we be non-judgmental and that we are self-aware of what attitudes we have about this illness. All right, on to allergic disorders. An allergic reaction is basically an interaction between the antigen and the antibody, and it protects against infection and harmful substances, harmful consequences of the antigen. There are, as I've noted before, different antibodies. The one that is involved with allergic disorders or reactions is the IgE. These IgE antibodies trigger mast cells, which are otherwise known as basophils, which you should be familiar from looking at WBC breakdown. And these mast cells then release these chemical mediators such as histamine, and that's what produces symptoms. So here's a little picture of a mast cell. You can see again the depiction of the antigen, and this would be the antibody, the IgE antibody that is specific to the antigen, and over here you have the release of the histamines. So there are different kinds of allergic reactions. Hypersensitivity, which is when allergic reaction itself is excessive or atypical. So there are 4 kinds. We're going to focus primarily on anaphylaxis. So anaphylaxis is when there is an immediate reaction to a specific antigen, and there's release of histamines and other mediators. Here are the symptoms, which you should be familiar: flushing, hives, angioedema, hypotension, bronchoconstriction. This is a broader depiction of what all happens with anaphylaxis. And treatments are antihistamines, corticosteroids, epinephrine, depending on the degree of the anaphylaxis. Supportive and or emergency treatment, if you again, depending on the degree of the reaction, you may just be providing oxygen and hydration, but you may also need to do emergency measures such as CPR, or they may need to intubate, depending. With respect to nursing, this is why you always ask about allergies. It's really, really important. And understanding higher risk situations such as transfusions, certain meds such as chemos, etc., certain chemotherapies, etc. You should always assess first, and then you need to recognize what's going on when it happens, and you need to act quickly. Dermatitis, just be familiar with the different types of dermatitis. These are some of the top types. In contact dermatitis, there is a reaction. There's direct contact with the skin, and it can cause either an acute or a chronic reaction, and there are stages to the reaction. These are the different stages, starting from itching, burning, redness, to then the skin. These vesicles can become weeping and crusting, and then eventually drying and peeling. It can be a real challenge to determine what the problem is, what the allergen is. Treatment also almost always involves some kind of corticosteroid. Latex allergies, this is a reaction to the natural rubber proteins in various latex products. Historically, it became a big issue when it was mandated to use powdered latex gloves. This was in an effort to prevent infection, but that requirement has been modified, and there is now a lot more availability of non-latex gloves, so the problem has declined recently. Routes of exposure, you can, not only is it necessarily topical exposure, but it could be exposure through aerosol parenterally, through, if you start an IV and the catheter is made of latex, you can insert a Foley if it's made of latex. So there can be a variety of routes of exposure. The response can range from just a mild dermatitis to a severe immediate anaphylaxis, and it can be a delayed response. It doesn't have to be immediately after the exposure. So the signs and symptoms of an immediate reaction are that itchiness, erythema, localized hives, and it can progress to more generalized hives, wheezing, dyspnea, laryngeal edema, anaphylaxis. On to chapter 39, rheumatic disorders. Rheumatoid arthritis, this is an autoimmune disorder, and they don't really understand the origin of it. It's usually diagnosed through symptoms, also rheumatoid factor along with anti-CCP testing. And the monitoring progress, you use both the ESR and the CRP testing. Signs and symptoms, classic sign and symptom with rheumatoid arthritis is morning joint stiffness. You need to know that, and it's lasting more than an hour. So that's classic. Okay. There are different stages to this, and I've listed here the treatment options for the different stages, so just be familiar with the stages and the treatments. Another rheumatoid disorder is lupus. This is an inflammatory autoimmune disorder that can affect almost all organs. And the incidence, this is kind of particularly common, among women. Causes are varied, can be genetics, hormones, drugs, and it's still not completely understood. Signs and symptoms are characterized by sort of periods of remission or very minimal symptoms, and then these acute flare-ups, and these can be there can be fever, malaise, weight loss, anorexia. There is this classic butterfly-shaped erythematous rash along the bridge of the nose. You can see a picture of it on page 1070. Other symptoms can depend on what organ is involved. There is criteria that was developed to diagnose it, and that chart is on page 1071. And if 4 of the 11 criteria are in evidence, then you have a diagnosis of lupus. Treatment is the goals of treatment are to prevent progression and loss of organ function. Basically, the treatments include pain management, immunosuppression with NSAIDs, corticosteroids, anti-malarial agents, and cytotoxic agents such as whatever that one is, belimumab, I guess. Okay, scleroderma is a complication of autoimmune diseases that affects the connective tissue of the skin, blood vessel walls, and internal organs. The first level of involvement is with the skin, and it's kind of a Raynaud's phenomena, in which there is increasing rigidity and hardness. So you'll notice that the skin is dry, smooth, and can be rigid. Extremities tend to stiffen and become immobile. There are slow, gradual changes. Many remain and may just remain in the hands and feet. When there are other organs involved.